Introduction. MRI has continuously evolved and has promised to revolutionize the various areas of medical science, and there are also numerous MR laboratories, but there is no laboratory of MRI present here in Nepal. So today's generation of research in medical science is the most promising leaders in MRI. So we are living in the times of great scientific research, and the impact on young researchers like you is extreme and very much profound. And the MRI is also born from the medical applications of physics, so there is a huge responsibility for MR researchers and physicists like you in upcoming new innovations. So there are various areas in MRI: acquisition, reconstruction and analysis, MR physics, neuroimaging, cardiac imaging, body imaging, cancer imaging, musculoskeletal, contrast mechanisms in MR like T2, T2 star, T1, spin density, diffusion, perfusion, and cross-cutting technologies like MR fingerprinting, synthetic MRI, functional MRI, that is fMRI, interventional MRI, molecular MRI, hyperpolarized, and MR safety and the MRS. So acquisition, reconstruction and analysis. There are also various subtopics in MR acquisition like artifacts. Artifacts are the noisy part in the images which doesn't represent the exact information in the MRI, and there is also the algorithms part, motion correction, MR fingerprinting, non-Cartesian imaging, fat imaging and the water imaging, and simultaneous multi-slice quantitative RF pulse, MR gradients, and new frontiers in image reconstruction like the Fourier transform reconstruction. MR physics. MRI is inherited from the hidden truth of physics, as I have already told, and the impact of MR research has affected almost every specialty of medicine. So, especially those that are based on the evidence-based practice like the radiology, ophthalmology, surgeries, and other aspects as well. Neuroimaging. In neuroimaging, stroke imaging, TBI, spine plexus, pediatric, psychiatric, demyelinating infections, dementia, Alzheimer's disease, also the ALS, amyotrophic lateral sclerosis, normal brain physiology, radiogenomics, that is the genetic variation of using radiation, and the gene expressions and the cancer imaging correlations, electromagnetic tissue properties. So these are the T1 and the T2 maps of the brain, which we can get by quantitative imaging. These are also the same, that shown is the grayscale image. Cardiovascular, that is myocardial viability, non-ischemic cardiomyopathies. Cardiomyopathy is the heart muscle disease, velocity and flow quantification, quantitative imaging, multiparametric imaging, atherosclerosis, cardiac metabolic rate perfusion, angiography, and the artifact correction. Body imaging, especially the liver, that is the MR elastography, which is based on the elastic properties of the tissue, and when the liver becomes fibrotic, the liver doesn't show its elastic properties, and at that time we call it the cirrhosis. So alcoholic people are more prone to cirrhosis. Lungs, mediastinum, pancreas, GIT, pelvis, adrenal, fetal, genitourinary, liver perfusion, and quantitative biomarkers, and advanced pulse lenses in spinico, gradient echo, and echoplanar imaging, and also the whole body PET MRI. PET is the positron emission tomography and MRI. So there is the fusion MRI. So this is the T1 map, T2 map, and the initial magnetization map. Cancer imaging, also the tumor microvasculatures, ultra-high field imaging up to 7 Teslas, and they are also moving on to the extreme field using the 20 Tesla MRI, quantitative cancer metabolism, metabolomics, that is scientific study of metabolites. Preclinical imaging. Before using imaging in human applications, they use the animals for imaging. So that is the preclinical imaging. So MRI is also used here. So it is a bridging research from bedside to the bedside.
Next.
Contrast mechanisms. There are various types of contrast, and the adrenaline screen labeling is the most interesting nowadays. Cross-cutting technologies like metabolic imaging, synthetic MRI. Synthetic MRI, if we acquire T1 image only, then we can get images from T2, flare, diffusion, perfusion, everything. MR fingerprinting is the most promising technology nowadays. MR genetics, MR radiotherapy using therapy. Functional MRI, there are also the various subtopics for research in fMRI. So we can also distinguish the emotions of patients, whether they are happy or sad, by using MRI. During SAD, the brain is more hyperactive. Interventional MRI, MR-guided interventions, and also the MRI using ultrasound. Musculoskeletal, there are also various subtopics. Hyperpolarized MRI, there you use the dynamic nuclear polarization methods. So MR safety, and the implant safety are very important here. MRS, it also shows the peaks of the metabolites in MRS, and it has applications in neurophysiology and body MRS as well. Molecular imaging, it comprises the contrast agent mediated alteration of tissue relaxation and the localization of the molecular disease markers like enzyme signaling molecules. Next, please. So, conclusion: there are numerous sciences of MR research and MR field. So, I would like to emphasize the promotion of research in MR education at every level of participation in conference, workshops, fairs, and everything. So, lastly, I would like to say that I always believe that when your patient's passion collides with your purpose, there is the explosion of light that ignites you forever. And I would like you to find, each of one of you to find your passion, and you can connect your purpose right at this moment in this historic Assembly Hall of St. Xavier's. So you can also pick up your interest in MRI and walk on the off-road express of MRI rather than the single traffic road. So thank you. I would like to thank the organizers and Professor Pandit sir. Thank you. Any questions?
One question.